Welcome to Arm Wrestling with COVID-19 in London. This is number 50 after my summer break. It's been quite a few weeks actually that I haven't spoken about the COVID-19 pandemic, and I haven't raised any of the medical issues or observations that I've had. The last time I actually spoke about this was, I think, sometime in July on the occasion of the 73rd birthday of the NHS. And at that time, I basically spoke about the facilities that the NHS provides. To my mind, the only medical care system in the world that is free at the point of delivery. But today, in the morning, as I was waking up and preparing my Arabic coffee, I was listening to the BBC Radio 4 flagship program, Today program, roughly toward the end of the program. So that should have been sometime around 8:45, 8:50 a.m. And the topic was, are GPs trying to avoid seeing patients in their surgeries, and are they now trying to do everything virtually? Now, I thought the conversation was quite interesting. The points of view that were shared by patients and medics alike were quite good. So what I'm going to do in the description box is just put the link to the iPlayer that would take you to the BBC program, and you can listen to the whole program if you want, or you can go right to the end of the program for today, Saturday, the 25th of September, and you will listen to this 10-minute exchange on the NHS and general practitioners. Now, as far as I'm concerned, I've been fortunate. I've been fortunate to have wonderful GPs when I moved to the UK from France. Be that when I was in Manchester as a law student. In fact, my GP then used to practice his Hebrew with me, and it was quite fun actually, because his conversation was peppered with Yiddish expressions. And then from there on to Scotland, and finally in London. Now, in France, before I came to the UK, the choices, I think, were more varied, since there is no gateway the way it works in the UK. For instance, here, no matter what you want to do, no matter whom you want to see, you have to go through your GP first, who would refer you to X, Y, and Z. In France, and although I agree that it's changed a little bit since my adolescent years when I was growing up there, but in France, the choices are more varied, as I said. I could go to any medical office, to any consultant, knock on the door, go in there, make an appointment, and see the person. I didn't need to do it via the family physician. So that's a different principle. It's a different way of dealing with it. But remember, in France, there were probably more choices, because I could choose my consultant. I could choose when I wanted to go and see them, but I also had to pay for that privilege. And even if I were insured, the insurance wouldn't cover the whole amount. In fact, why talk about France? Look at the US system. I mean, it's a money sponge. Before they even take the stethoscope out of their pockets, they make sure that you are fully insured and you'll be able to cough up the money that they ask of you, and what a lot of money that is. So I personally take exception, as I did today when I was listening to some of the perhaps justifiable complaints by some people. I take exception to those criticisms against the GPs, not only because I've been fortunate enough, lucky enough to have good GPs across England and Scotland. No, it's because we as patients, we as men and women going to see our GP, we're only thinking of ourselves. A GP, on the other hand, has to think about hundreds and hundreds of patients. Of course, it could be better. Any system could be improved. There is no doubt about that. There are delays. Sometimes there are huge delays. We know that. Now we're experiencing it. Not so much in GP practices, but perhaps more so in hospitals. And of course, these men and women who sit behind the computer and then listen to the complaints of patients, sometimes complaints that are very difficult to pin down, they're tired. They're exhausted at times. And some of them retire early or simply leave the practice. I know one of my GPs, a wonderful man with whom I had a very good rapport, was burnt out, and he told me, to be a doctor, not an administrator. And my current GP, who is so much devoted to his profession, sometimes feels also disheartened in an attempt to explain his frame of mind. So of course, they sometimes prefer virtual consultations. The pressures are enormous. And remember, there are 60 million of us who are benefiting from a system that was created, a unique system that was created, that is still free at the point of delivery. So these men and women who work mornings and afternoons and sometimes evenings, when they finish seeing the patient, that's not the day for them. They have to sit down and do the paperwork, write the letters, what have you. They're even at times abused. They're attacked even, pressured sometimes to write prescriptions for drug users, criticized when the system doesn't work smoothly. I could do it. Trust you me. I've had my bumps, not only with GP practices, but also with hospitals and with walk-in clinics and with the whole medical NHS system in the country. But why criticize them? Why single them out? And not also the patients who abuse the system. I'll give you an example today. It's a silly example, but I'll share it with you anyway. I could give you many more examples, perhaps more pertinent than this one, but never mind. Today, I had to change 2 buses to go somewhere for an important meeting and then come back to base. And in one of those 2 buses coming back, there was a woman sitting at the front who refused, point blank, to put on her face mask. Now, the driver of the bus kept pressing on the button, which comes up with that loud message saying that you are requested to put your face mask on, etc., etc. And she was shaking her head and pretty much saying, I'm not going to do it. Hold on. What is this? Bravado? Conviction? Determination? Or sheer silliness, if not outright stupidity? Because by not using that face mask, for instance, what happens? It's not that she might or might not get this dreaded virus. It's that if she does have it, whether with symptoms or asymptomatic, she might be able to pass it to others. The bus was full, by the way, and incidentally, they weren't all sat. There were even people standing up. So the days when you only had 10 people in the bus are long gone now, in our days of normality, according to our government. So if she passes that virus on to somebody, what's that going to do? That is going to cause problems for other people. And eventually, who's going to deal with them? The GP in the practice or the A&E in a hospital. It's stupid. It's silly. It's not a question of my principles. No, it's a question of being compassionate, being understanding, trying to help others as well. And besides, I mean, forget the patients. If you're going to tell me, no, Harry, you're off on the wrong piste, on the wrong course, patients shouldn't be criticized, fine. What about, instead of criticizing the medical system or the medical people, why not say that they're sorely underfunded? Why not ask the Chancellor of the Exchequer about it rather than the medics themselves? More radical even. This NHS was created in 1948. 73 years have passed since then. If it's not working, should we not think of how to improve it? And don't tell me let's privatize it, because that takes me back to the American system. And I just told you what a money sponge that system is. Why can't we address that? I mean, I'm not against criticism. Trust you me, I do my fair share of criticism, right, left, and center, when I see something that, in my opinion at least, is not working well. But after all, before the but, after all, wasn't it? And I like using these quotations because they're helpful for me, at least. Aristotle said, criticism is something we can avoid easily by saying nothing, doing nothing, and being nothing. And that's not what I'm advocating. I'm not saying that. I'm not asking us, I'm not asking myself to say nothing, to do nothing, and to be nothing. Because criticism can be constructive, but criticism can also be destructive. And this is where I come to my other philosopher, a very, very important philosopher with whom I grew up when I was even pre-teens, Elvis Presley. What did the crooner, the charmer, what did he say? He said, don't criticize what you don't understand, son. You never walked in that man's shoes. And that is quite, I think, relevant to what I've been trying to share with you today. Now, when I say this, let me also be clear, no medical federation, no medical system, no doctor has sought my legal services. Nobody has asked me to record this YouTube episode number 50 in order to defend GPs. They probably don't need my arguments. So I'm not defending them. But all I'm saying, on the back of that 10-minute program on the Today program that I listened to today, I think it was with Justin who was presenting it, I'm not sure. All I'm saying is, next time you make your call to the practice in order to make an appointment, remember, just remember, that there is a human being at the other end of the line too. That's all. So take care, and I hope you like my makeup image, and have yourselves a nice weekend.